Hi guys, welcome back to my channel. I'm Dr. Jenny and today we have Dr. Kritika who has scored 229 in December 2021 Fmge, which is an amazing score. So let's listen to her and listen to her strategies and tips which she's about to share with us. I hope you find this video useful. Dr. Kritika, can you please introduce yourself to us?
Good evening. I am Kritika Singh and I did my MBBS from SSR Medical College, Mauritius. This was my first attempt and I scored 229.
Scoring 229 in your first attempt is very good and it's something amazing and congratulations. How will you rate the exam, Dr. Kritika? How was it on a scale of 10? How much should you give?
5 to 6. It was a moderate exam, but the questions were tricky. It was not straightforward.
Okay. So it was a moderately difficult exam with trickier questions, right? And how about the options? Were the options easier to rule out like last time?
No, ma'am. The June 21 exam was very easy. I felt that. And the question was very tricky that there were clinical cases, 4 to 5 lines, and there were images, but those were less this time. Only 50 to 60 were there. And one-liner questions, direct questions were very less. And the options were also like, I felt it was easy to rule out if you know the topic.
Okay. And can you share us about the subject weightage, the subjects which are of given higher weightage and the subjects with low weightage?
The subject with higher weightage were medicine, PSM, ENT, OBG, and PEDS. And with low weightage, I felt that physio, psychiatry, and ortho. Like many few questions were there from these subjects.
Can you share us about the questions pattern, whether more of clinical based scenarios or whether more of one-liners, or was it mixed?
It was mixed, but more clinical cases were there, like 4 to 5 line or 2 to 3 line. One-liners were very less. And images, I told you 50 to 60 were there. And yeah.
And was time enough for you to complete? I mean, were you able to cross-check again once you were done with your exam?
Ma'am, I completed my first paper 45 minutes before and second paper 30 minutes before, but I didn't cross-check my answers because I could have changed my answer. So that I didn't do that.
Yeah, changing your answers at the last moment might not work for everybody.
Yes, ma'am.
Right?
Yes, ma'am.
Yeah. When did you actually start preparing for December 2021 FMG? Was it before 6 months or 1 year?
No, ma'am. Actually, I did medicine in my last year during my college days, and I came back around in month of May, end of the May, and I started preparing in June, July, but I was not consistent. Like it was on and off. But I completely started from August. Like I was sincere from August. I was consistent in my studies.
Okay, so it was 3 to 4 months of full-on preparation, you'd say, right?
Yes, ma'am.
But you started it on and off in the month of June, before 6
Yes,
months.
ma'am. July. Yeah.
Okay. So, Dr. Kritika, what are the study resources that you used? Did you enroll yourself into any coaching classes, or did you use any online apps? We have so many apps these days. So, which one did you use?
I just used Pep Ladder and Fmge solution book.
Okay. And any other Unacademy or any other apps for
No,
solving
nothing
MCQs?
else.
Only Prep Ladder and FMG Solutions by Dr. Deepak Marwa.
Dr. Kritika.
Okay. And can you tell us about your strategy which led to this amazing score? Any secret that you would like to share with us?
Ma'am, consistency was my secret. Like I was very consistent after the month of August, and I planned everything beforehand, like how many subjects I have to do till September, and October, November were just for revisions. And I did, I think so, 8 to 10 subjects from rapid main videos, and nine subjects from rapid revision. So I planned everything beforehand, and I watched Men in Black series from Teplada, and they told us to do the 7 subjects from videos. So I did
May I
that.
know what are those 7 subjects? I'm sorry for interrupting. May I know what are
Yeah,
those
yeah.
7 main subjects?
Ma'am, anatomy, patho, pharmac, uh, micro, and OBG, PSM. I think so. That's it.
Yeah,
Then,
thank you.
yeah,
You can go on.
these are only 6. There's one more subject. I think so. Ortho was there.
It will be
Yeah.
useful for
So
your juniors.
yes,
Yeah,
ma'am. Yes, ma'am.
go on.
I did these. These were high yield, so I did that. These from main videos, and I also did few more subjects like psychiatry, medicine, biochem. These from the main videos. And after that, I did from rapid revision, and like I was focused on these subjects first, and I did the PYQs, notes, then Fmge solution book and snapshots. Like I have to finish all these subjects to complete one subject. Like these were my things. Yeah.
Okay, and how many hours did you study every day?
Ma'am, I started with I think so 5 hours per day, and I increased gradually, and towards the end it was around 12 hours per day.
And I'm also curious to know about your daily schedule. What was it like? When do you usually wake up, and when will you start studying? And were you a morning person, or you used to study at nights? Can you share with us?
Yes, ma'am. I'm a morning person. I used to wake up around 6, and 6:30 I should start studying. And my target was like till 12 I have to complete 4 hours. Like 4 hours. I like my sitting was for only 30 minutes in the beginning, and thereafter I increased it to 1 hour, 2 hour, and I used to do the videos first, like first 4 months, 3 to 4 months I was only doing the videos and the MCQs subsequent to those videos. So and I only did one subject per day. Like I didn't mix 2 subjects. I finished one subject and then started the other subject. So till 12 I used to do like 4 hours. 4 hours I have to complete, and after that, like I used to have my lunch and everything, and again I used to start studying for I think so 2 hours. Then I used to take a nap also, and after I think so, uh, like when I was studying like 8 to 10 hours, I was done by 12 maximum. Like I used to
Okay.
sleep at
Mhm.
10 and again start my cycle.
Okay. Any tips that you would like to share about solving MCQs, how to rule out options? Because many people find it difficult to solve MCQs and they don't do it enough. So, can you tell us about the importance of solving MCQs as well as any tips to solve QANs and MCQs?
Ma'am, whenever they are doing the subject, I think so with that subject, they should be done with the MCQs, like the rapid revision MCQs at least. So, and with time, like with time, you'll be able to rule out the questions, the options, sorry, the options, and there was no tricks for solving the MCQs, but the more you solve, the more experience you gain, like how to solve these questions and what to rule out, what not to rule out, and everything.
True. Yeah, true. And can you also tell us about the importance of mocks? Because as I told about solving MCQs, many students they are afraid to even try out mocks. So can you tell us the importance of mocks and how many mocks did you give before appearing for December FMG?
Ma'am, I gave around 10 to 11 mocks before my exam, and I think mocks were very important for achieving this exam, this score, because I used to know like which topics are very important, where I should focus on, where I'm lacking. So in the beginning, I used to get around 130, 133 in the mock exam, but subsequently it increased. Like it increased, and I used to give one mock per week in the last 2 months. And before that, I was doing one or two mock tests per month.
Okay. And may I know how was your reaction when you came to know that you have scored this amazing 229? What was your reaction like?
I didn't expect like 229 is a good score. And I always targeted
It's
that
a
I
great
should
score.
touch 200. Yes, ma'am. Thank you so much.
Okay.
I targeted 200, that I have to touch 200, and I was really happy. My parents were really happy.
Were you expecting the score?
No, ma'am. I watched the recall videos, but I stopped at 150. That I'll pass. I didn't watch all the videos.
Okay. And lastly, any tips that you would like to give our fellow foreign medical graduates who are about to give their June 2022 SMG?
Yes, ma'am. Ma'am, don't lose your hope. Like, I used to feel that I'll not be able to clear or complete my course, or there are many subjects. So many times I used to feel very disheartened, but and I used to watch YouTube videos, and interviews to make myself motivated again to study. So I'll tell the aspirants to not to lose hope and just study consistently. Don't change your sources. Give GTs, and even if you are scoring like 130, 140, you'll score uh, better than that, because GTs are really difficult for prep ladder also. So yeah, that's it. Don't lose hope. Take frequent breaks also. That is also very important. But study consistently.
Okay. And what are your future plans, Dr. Kritika?
Ma'am, I have to do my internship, and I'll be preparing for NEET PG.
Okay. Good
Yes,
luck
ma'am.
on that. And thank you for your time. And thank you for sharing your journey with us. I hope all our foreign medical graduates find this video useful and motivating. I extremely learned a lot from our conversation. And congratulations again on this amazing score. And thank you.
Thank you so much, ma'am. Thank you so much for having me.